characterized by periods of apnea of 10 to 20 seconds, separated by approximately equal periods of hyperventilation, where the tidal volume gradually slowly waxes and wanes. Mechanism is likely to involve an abnormality in the chemical control of breathing, possibly a poorly responsive, or overdamped control system. Another cause of Cheyne-Stokes in patients with cardiac disease is the prolongation of the lung-to-brain circulation time, so that it takes longer for changes in arterial gas tensions to affect the respiratory area in the medulla. Apnea causes an increase in pCO2 in the lung blood, but in patients of cardiac failure, this takes a few seconds to reach the medulla. Once the blood reaches the medulla, respiration is stimulated. Overventilation causes a decrease in pCO2, and an increase in PO2. It takes a few seconds for the altered composition of arterial blood to be transported to the medullary centers, and for it to inhibit the excess ventilation. By this time, the person has overventilated for an extra few seconds. Therefore, when the overventilated blood reaches the medullary center, respiration is inhibited to an excessive amount. Then the opposite cycle begins. Again, it takes the brain a few seconds to respond to these new changes. When the brain responds, the person breathes hard once again, and the cycle is repeated.